Hello everybody. I'm delighted to be with you today to launch another one of our exciting Nursing Now Challenge Global Solution initiatives. On this instance, we're partnering with some great colleagues from immunisation advocates at the Sabin Vaccine Institute. Over the next hour and a half, you'll be hearing some amazing stories about how nurses and midwives across the world promote vaccine equity and acceptance. And without further ado, I will hand you over to Vince Blazer, who is the Director of Immunisation Advocates at the Sabin Vaccine Institute. Over to you, Vince.
My name is Vince Blazer. I'm the Director of the Immunization Advocates Program at the Sabin Vaccine Institute. On behalf of Sabin and the Nursing Now Challenge, we really appreciate you all joining us today to talk about utilizing nurse and midwifery voices for vaccine advocacy, for vaccine acceptance and equity. I am going to start a couple of slides here to go ahead and get us kicked off. So just a couple of housekeeping pieces just to get us going before we dig into this. The first is there is a Q&A function on the bottom of your screen. And so throughout the presentation, please use the Q&A function to ask questions of any of the panelists. There is the chat function as well, so please take a moment to introduce yourselves with everybody on the chat function. But please utilize the Q&A function to ask any questions of the panelists. Okay, so I guess first question maybe on everybody's mind is why are we doing this and why we're here? So the Sabin Vaccine Institute works primarily on driving the various pieces that are needed to ensure that every community has access to the information and they need and has access to vaccines that can prevent and save lives. So, and Nursing Now Challenge obviously works with young nurses and midwives around the world. So it's in the current environment, it's not a surprise that we came together on a partnership. But why are we looking at doing specifically elevating nurses and midwives' voices in storytelling and advocacy? I guess just a few things, and some of this many of you are very aware of in what you face every single day, and so I don't want to harp on it too much, but obviously the pandemic has taken a major toll on the health workforce and nurses and midwives in particular. ICN estimates that at least 115,000 health workers worldwide have died, and that estimate was, I believe, last month. And so obviously it's higher than that at this point. WHO has recently, a few weeks ago, said that only about 1 in 8 health workers around the world have been fully vaccinated, despite a lot of rhetoric on prioritization of the health workforce in COVID-19 vaccine rollout. And a majority of those a majority of health workers have still not received even one dose, and only 1 in 8 have been fully vaccinated as of a few weeks ago. So obviously there's a major need to continue to push for health workers to be prioritized in COVID-19 vaccine rollout. Because the obvious critical nature of nurses and midwives being the majority of care providers and health service providers worldwide, so their crucial nature of success in ending this pandemic, not to mention the tremendous mental and physical toll that this pandemic has had on the health workforce. And we're obviously seeing across several settings a lot of mistrust and lack of information and transparency on policies and plans on COVID vaccines. And some of that misinformation and disinformation that's out there is also having a negative impact on your ability to deliver high vaccination rates of the routine childhood and other immunizations. WHO and UNICEF just last month reported on routine immunization data for 2020, and 23 million children missed out on basic childhood vaccines in 2020, and that's the highest number since 2009, and 3.7 more million than 2019. And unfortunately, I think in 2021 the outlook is perhaps even worse. And so, on the flip side, the major global bodies have made major commitments to the workforce and global vaccine and rollout. And the WHO and World Bank have called for 50 billion in new financing for low income settings for preparedness and vaccine equity activities. So there's a lot of opportunity. There's a lot of major calls to right this ship. But in order to do that, policymakers and implementers really need to hear consistently from health workers. It's great that that we've done a lot of applause for health workers and honors and whatnot, but especially as these COVID-19 vaccines are being rolled out, policymakers and implementers, they need to have the real-time experiences that you're seeing week after week or month after month be heard in order to better inform what they're doing in terms of their policy decisions. And a really great example of that just happened last week. Dr. Tedros, the Director General of the WHO, in the weekly WHO press conference, led with this video that I'm going to play that is featuring one of the speakers we're having later today. So just go ahead and play that. Okay, so I guess we're having issues with video sound today. Don't understand what's happening there, so I apologize for that. I could hear it on my screen, but I guess other folks could not hear it. So let me go back to the slides. But Dr. Tedros led with the experiences of Harriet Niega, a midwife from Uganda who had been communicating and shared her story in January with folks at the WHO. And sorry, I'm just gonna get back on the slides. Apologies, 1 second. Harriet will be speaking with us later today, but Dr. Tedros basically said that her story was important in thinking about how they were developing their policies in health workforce. And then she just emailed them this week about what's happening in COVID-19 vaccine rollout in Uganda. And they're taking that to heart in that a lot of countries still have very little access to COVID-19 vaccine rollout, and there's little choice or a lot of folks to in their workplace to be able to protect themselves. So she made an urgent plea for COVID-19 vaccine rollout to accelerate in Uganda and other countries. And so the bottom line of that story is that her story and her experiences that she faced mattered in the highest levels of global policy in terms of the COVID-19 vaccine rollout. So that's our challenge for you all today, is that we're launching this challenge to elevate nurses and midwives' stories. And so the challenge that we're asking, and the challenge that we're asking for here is how can you utilize your personal experience as a nurse or midwife in interacting with patients, friends, family, and colleagues to inspire other nurses and midwives leadership in advocating for vaccine equity and acceptance in your community or your country. And I'll note that this challenge, it shares a name with another campaign, Voices for Vaccines, that's part of the Task Force for Global Health. That's a campaign for parents on vaccines, and it's not affiliated with us, but apologies if there's any confusion there, but it's not affiliated with that challenge. Okay, so what's the process here? If you're interested in telling your story about this, basically what we're asking you is to develop a proposal in 1,000 words or less that propose your solution to that challenge question. And as part of that, we'd like to hear a little bit about your story. A time that you either successfully managed an interaction with patient or colleagues, or influenced in some way immunization decisions, either in your workplace or with family and friends. We want to hear a little bit about the COVID-19 vaccine situation and some of the challenges that you're facing in your country or your community. And we would like to hear your ideas of what you would like to do in your community to advocate for vaccine equity or acceptance. And so, this could include, but it's not limited to, addressing some of the gaps to barriers to factual information that your community is seeing for COVID or for other diseases. And, as much detail as you can provide as to the specifics of what you would like to do, we'd love to hear your ideas. Obviously within that 1,000-word limit, but I think that we're really open to, there are many, it's going to take all of us to raise our voices here. And so we've seen some really great ideas being shared, and we have several other folks speaking today who are going to share their experiences. But we would really like to hear your ideas. And sorry, I lost my slide there. Okay. So once we receive all those ideas, we will select between 5 and 7 winners of this challenge. And each winner is going to receive a 5-week professional development training course led by a leading storytelling and leadership trainer, Dr. Pedja Stojicic, who is here with us today and is going to share a little bit more about his about what that will entail. And we'll also be sponsoring a session at the ICN Congress, which is the biennial global gathering of nurses, November 2nd through 4th. And we will be talking about the importance of nurse and midwifery leadership in vaccine acceptance and advocacy during that Congress. And so the winners will also receive $1,000 in prize money to develop their activity over the following few months, and as well as complimentary registration to the whole of the ICN Congress, of which there'll be many great conversations among among nurse leaders around the world for that Congress. And so by accepting this, the winners agreed to take part in the entirety of the storytelling training. We know that many of you are working a ton of hours, so it is a commitment. It is a great professional development opportunity, but it is a commitment of 3 to 4 hours per week from mid-September through mid-October. And then, after the ICN Congress, working on implementing the advocacy activity that you have come up with, and providing a short update for us by mid-January of how that's going, and sharing the impact of the experience that you had in the training, and working with other nurses and midwives at a webinar that the Nursing Now Challenge will have in 2022. Hannah, I'm not sure if you, Munashe, could I ask you to come in here to just say a little bit more about how folks can apply and what they need to do, and any other pieces that I may have missed?
Yes, sure. Thank you so much, Vince. And it really is an exciting challenge, and we really are looking forward to getting so many ideas from nurses and midwives across the world. So to be able to submit your submissions and submit your ideas, please email your solutions to the challenge to info@nursingnow.global, and for your ideas to be in by the 10th of September 2021. And if you want any more information, you can be able to look on the Nursing Now website. I think Hannah and Andrea have put in the details of the website and the challenge on the chat platform, so you can check the platform for the link. And yeah, we're looking forward to being able to have so many people involved in this challenge, because it really is a critical discussion, and looking forward to being able to have so many people contribute towards this. Thanks, Vince.
Okay, great. And so the last piece is just to say that we will come back, and there'll be time we'll answer some of the questions at the end. But if you use this short link, and we'll send around the slides as to the participants here, you can utilize that link to go directly to the challenge materials. And I will also say that Sabin's Immunization Advocates website, immunisationadvocates.org, we have a wealth of resources. We have a resource hub for health workers that have a lot of free courses, materials on how to, on some of the latest information on vaccines from a lot of the public health authorities, some short videos and the like that all can help folks in communicating about COVID vaccines, about routine immunization. So please check that out. There's multiple really great free courses on that site, immunisationadvocates.org. Okay. Next on our agenda, I want to introduce Dr. Pedja Stojicic. I mentioned that Pedja will be leading the training for this challenge, and Pedja is also a leading leadership trainer on many different issues, and runs the organization People Power Health. So Pedja, I will turn it over to you.
Thank you, Vince, and it's such a pleasure to be here with all of you. And I want to thank Sabin Vaccine Institute and Nursing Now for inviting me, and honestly giving me this opportunity to pass on some of the skills and practices of storytelling and public narrative that I'm going to talk a little bit about. So my name is Pedja Stojicic, and I'm, as I said before, I'm an executive director of People Power Health, and currently also a senior fellow of at the FXB Center, Health and Human Rights Center at the Harvard School of Public Health. But I'm originally, and maybe that's something that I can share as an example of my own story. I hope you can see the slides. Can people see the slides just to check?
They haven't started yet, Pedja, so maybe give it 1 second.
What about now?
No, you're good now. Yep.
Okay. I'm currently, as I said, I'm in different institutions, but I'm originally from Serbia, from Belgrade, where I grew up. And I was born in Yugoslavia, and it used to be that I always joke that I've changed 4
Hey, Pedja, your sound has gotten a little faint, so maybe if you could just either do a little bit louder. Sorry, apologies.
No problem at all. Is this better? I hope it is when I hold the mic.
It's a little better. Yeah.
I was, as I said, I was born in Yugoslavia at the time, and kind of changed the 4 countries without moving, because it was Yugoslavia and Serbia, and then Serbia and Montenegro, and now Serbia. So it was kind of interesting situation because there was a war happening in the Balkans. And I'm a doctor and physician by training, but I always say that I have 2 parts of my education. One was coming from medical school, and the second part was coming from the streets of Belgrade, both organizing young people to fight against the dictatorship in Belgrade, but also organizing them to address a big health problem in Eastern Europe that was about HIV/AIDS epidemic at the time.
Hi, Pedja. Sorry, a lot of folks can still barely hear you, so I apologize that I keep interrupting there. But I don't know if you could try without your headphones and see if that works, or
what about now?
That's better? Great. Yes.
Okay, yes. Great. Wonderful. Okay, so as I said, it was kind of 2 types of education. And what was really interesting in the medical school, I remember vividly when a professor of mine came to me. He was a surgeon, because it was during the war, and kind of even as a student, you can practice a lot of medicine. I will get into the operating theater and kind of help with some things. And he would say, you're good with your hands, but you have to stop wasting your time on that community health stuff, because that's not what is going to make you a doctor. And, it was really hard for me to reconcile that, because for me, medicine was always about both the community and the healing of one person. And up to this date, I didn't follow his advice. I've actually decided to dedicate my career to community health and to work with communities and enabling communities to do this type of work. And that includes storytelling as an important practice of both leadership and healing. And in this program and this challenge that you're going to experience, as if you apply and you become part of the program, the training that we do is, the official title is about storytelling, but actually we're talking about leadership, and leadership as a practice of accepting responsibility for enabling others to achieve shared purpose in the times of uncertainty. And this leadership definition comes from a professor of mine, Professor Marshall Gantz from the Harvard Kennedy School, who was a union organizer and activist for decades. But it is really important to think about it not as a diva style model of leadership where we are at the center and everybody else is following us. But in reality, it's the interdependent leadership where you are enabling other people around you to achieve a shared purpose. And it turns out that storytelling is a really, really important part of that. As human beings, we have 2 ways of understanding the world. One is with our head, kind of like a strategy, how do we think about certain things, how do we make some logic out of the world that is around us. But the other part of our understanding, and we all know it because we've experienced it, is with our heart, with our really deep understanding of kind of why things matter, why they're important, what are the values that they hold. And only when you have both sides, the strategy and the heart, the head and the heart, you can see some people being moved into action. And that's exactly what we are trying to do here is, because in medicine, in my experience, and I know it's the same in kind of like for physicians and for nurses and for all the health professionals, we are so focused on our heads, on our thinking about how do we solve problems that are in front of us. And we kind of tend to lose the practices of our heart, which is actually the storytelling is the way to share the practices of our heart. And in this program, like in this training, that's what we will try to do, is to enable everybody, to not just to kind of like understand the problems logically, but to communicate and connect with others in a way that will inspire their hearts and therefore move them into action. Because only when you have those two, you can achieve and you can move into action. There's a particular practice of storytelling that we teach that is coming from a professor that I've mentioned, Professor Marshall Gantz, that has three components: the story of self, because it's important for people to communicate, why do I care? Where is it coming from me? Why it matters to me? Then the second part is the story of us. Why should we care? Like, why should our community be aware of that and care? And then the third part is the story of now. Why now? Because the action is always, as they say, like it's the time is now. It's not in the future, because the now is the only time that we have. So those three components, like when we teach public narrative and storytelling, we will use those three components to practice, both, and enable people to share why they care, to enable them to share why we as a community should care, and then why now? What is the call to action that can, that is important and that is urgent enough? Because I think we face a lot of urgency these days that will move people into doing something about it. And the pedagogy, let me talk a little bit about the pedagogy of the course. And there's a reason why this is a bike with training wheels, because if you think about how do you learn any skill, like riding a bike, for example, you don't learn it by studying by psychology or reading or watching videos about, how the bicycle should be ride. You learn it by getting on a bike and try it on. And that's exactly what we are going to do. We are going to have a lot of practice of storytelling and support for storytelling that will encompass trying things on, like, sharing it with your colleagues, sharing it with other people, and getting some coaching and feedback. And that's why we have the training wheels, the scaffolding, the support, so we don't have to, fail often, but like at least there will be some support to get you on the bike so you can keep the balance and learn the new skill of storytelling in this case. In terms of particular way we are going to do it, as Vince has mentioned, it starts on September 14 and it goes into the November 2nd, where you will have the presentation at the conference, those who are selected. There are 6 weeks, like each week will cover a specific topic, as I was sharing before, like story of self, story of us, and story of now, and then kind of like mixing it all together with a session that will also be kind of like grounding that experience of storytelling in the advocacy for vaccine acceptance that will be led by Sabin. We are going to have like 3 elements to the learning. There's a application for the micro learning that we are using that can help you learn some of those things as you go. It doesn't require kind of like you be fully present with the group, and you can do it as when you have a free time, because I know people are really, really kind of like busy and they have a lot of things on their plate. There are online live sessions, like for 90 minutes every week. We will have a gathering when we get together and do some kind of like interaction and coaching and practicing. And then there will be coaching and support as needed, throughout the program and towards the end when the conference is there. But altogether, I would say that you might look at this as an opportunity to share your story, especially about vaccine acceptance and your stories about generally your work today. But it's also something that many people who does this training find to be like an amazing leadership skill that then they apply in different settings, in different contexts, in different, with different people to enable them to move into action, because that's the ultimate goal of all of this. So Having said that, if you have any questions, feel free to reach out either during this conference or even after that. I'm happy to answer them and give you some additional information as well.
Right, great. Thanks, Pedja. And as Pedja mentioned, please go ahead and drop questions in the Q&A piece. We'll have some time to verbally talk about the questions at the end, but please go ahead and do that, and we can continue to answer questions there. Okay, next we're going to talk a little bit about the type of impact this type of storytelling can have, particularly for nurses. And so I'm going to turn it to Professor Maureen Bisignano to talk a little bit about that. And Maureen is President Emeritus and Senior Fellow for the Institute for Healthcare Improvement. And so Maureen, look forward to hearing from you.
Thanks, Vince, and thanks, Pedja, for that great introduction. I wanted to talk about influence and how nurses can really have an influence through storytelling. And I do think this is a general topic, but specifically to thinking about vaccines, I think it's really such an important time for us. Next. So if you think about, can you change to my next slide? Thanks. The first person in the United States to receive the COVID vaccine was Sandra Lindsay, a nurse in New York at Northwell. And it was very strategic to pick Sandra to be the first person to be vaccinated. She was actually vaccinated with newspaper reporters around her. And she talked about how anxious she was because of COVID to get the vaccine. And I think her symbolism is going to really reach so many people, to have a nurse, because I think her voice is really going to make a difference. It was an amazing thing to see. It was so historic, this moment, that all of her scrubs and her name badge and the mask that she was wearing are now in the Smithsonian History Museum to pass down the legacy of this first person who took the vaccine. So if you go to the next one, I wanted to start, just as Pedja had said, about a story of me and how I learned to tell stories. This is, you're supposed to laugh when you see my picture from such a long time ago, but I was a young nurse working in an ICU, and I used to walk down the hall every day to the ICU through a pediatric unit. It was a brand new building. The ICU, 14 beds, was filled every day. There were patients in the hall. There were patients in the emergency department that couldn't be admitted. And yet the pediatric unit was empty. And so maybe 2 patients. So one day I went to the head nurse of my unit, and I was a young staff nurse. And I said, I've read about these new telemetry units. That's how old I am. And I think if we were able to transform the pediatric unit into a telemetry unit, we could work on flow. And she just said, no, you can't do that. You're a nurse, go back and take care of the patient. But I had so much pain in my heart every day walking into this unit of overcrowding and knowing we could solve this problem. So I went to her and said, could I talk to the supervisor? And she said, yes, and I did. And the supervisor said, no, go back to work. Finally, I persisted, and I got down to the chief executive's office. And I told him the story of how I thought we could solve this problem. And he laughed at me and he said, well, if you can go talk to the pediatricians to move out of the new building to the old building, then I'll give you the money to buy the equipment. And so I went to the pediatrics monthly meeting, and they just threw me out of the meeting. I learned how to tell stories. I went back to the monthly meeting for 6 months in a row. And I learned that the way that I had to influence people, as Pedja had said, is to get to the heart and the head. And I would also add to the wallet. So what I did was I started telling stories, and I started telling a story of a patient who was unable to get in and what the impact was on his family. And I could see that some of the pediatricians were leaning into me, but many were just saying, no, we're going to kick her out again. And then I told the story of I said, at the end, I said, and I want to tell you, it's not just this patient. And I extrapolated to the numbers of people who were stuck in the flow problems. So I told a story, I extrapolated to the total population. I talked about the human cost and the pain of families being separated because we had to move patients to other hospitals. And then I talked about the financial cost. And at the end of 6 months, the pediatrics unit was moved, and I got the equipment to start a telemetry unit. And I think it really taught me that we as nurses can have influence when we use our voices, particularly through stories. If you go to the next one, we are the most trusted professionals, rated most trustworthy and honest for 19 years in a row in the United States. And I think we're also good at seeing the whole system. So nurses tend to be able to reach out and see across the boundaries of the specific patient problem. And that gives us a unique perspective. And then that helps us to build the arc. So a personal story, extrapolation, human cost, financial cost, and then impact on the staff. The impact on the staff when they're dealing with broken processes every day is profound. And I think we have to remember that all of these will get to somebody, but you have to create that arc of a story so that you can get to everybody. If you go to the next one. So I learned to tell stories. And then when I was 34, I was asked to be the CEO of a hospital. A 34-year-old woman nurse was pretty unique at that time. But I think in part it was that I was able to bring people to seeing problems and solving them in a different way. And then when I became CEO of the Institute for Healthcare Improvement, a global organization, I learned that it's very powerful to interview patients. So every time I would talk to leaders, I would say, when I will talk about leadership, I want to begin by interviewing a patient. One of them was Gilbert Salinas. Gilbert was 19, a young man in LA, Los Angeles, and he was afraid of gangs. And he and his friend were playing with a handgun one day, and his friend accidentally shot him and he became paralyzed. And I was asking Gilbert in front of 700 nurses and doctors, tell me about your healthcare. And he said, oh, it's wonderful. And I said, tell me about your wheelchair. And he was telling me stories about it's great, except when he gets a flat tire. I had been in healthcare for decades, and I never knew that wheelchairs got flat tires. It takes 3 weeks to get his tire changed. And one of the nurses in the audience jumped up and she said, Gilbert, I'll get you a new spare tire. And I said, no, you can't solve it for Gilbert. You have to solve it for everybody. How many other patients are in wheelchairs in your system? Nobody knew except for Gilbert. And then he told me other stories about needing to reuse Foley catheters and how they gave him urinary tract infections. When he told his story, and then we extrapolated to the other 2,800 people in that state with wheelchairs, and then we looked at the human cost of hospitalizations and urinary infections, and then we looked at the financial cost, then everybody came together to solve that problem. So if you go to the next one, we have a lot of leadership challenges today. Everything's changing. And so you can use your voice in so many ways. But if you go to the next slide, and I'll send you all my slides, it requires a new way for us to think, a new way to lead that looks at all of these impact pieces of the story, seeing across the system, building teams, co-producing health with patients, and using our voice by telling stories. So if you go to the next one, I'm going to very quickly tell you a story and how it had influence. I was in Sweden, and I always find my stories by saying, take me to the place you're proudest of, because I would never know to ask to visit some of these places. And I went into a patient self-dialysis center. It was something I had never seen before. I've seen inpatient dialysis, I've seen outpatient, but I know patients can do their own dialysis at home. but I'd never seen a place like this. So I said, who started this? And they said, oh, we're pioneering and innovative. I said, no, who had the idea? And I met this young man, Christian Farman. He was a mechanic for Saab Aviation. He made planes. And he said in 2005, he got glomerulonephritis and ended up on dialysis. Can you go to the next one? So he told me that he thought he could do his own dialysis and he could have a better outcome. They're now up to 75% of their patients are doing their own dialysis in a separate place. They didn't want to do it at home because of social isolation and problems with equipment. And they also wanted to learn from each other. So if you go to the next one, the nurse leader told me that what she learned from the patients is that she needs to understand their whole lives, not just their clinical problem, but are they working? What is their family situation? And next, so she built a unit where the patients let themselves in with an electronic card key. They enter the hospital wing themselves. They make their own appointments. They make coffee for the nurse who comes in every day, but 24 hours a day, they're in there not only doing their own procedures, but they're exercising for health. I've been to dialysis units from Vancouver to New Zealand, and I've never seen such a healthy group of people because they see holistic health. Next. So now their costs are 50% of other units, dramatic reductions in complications, and they measure their success by number of patients working. So I asked Christian, the patient I met first a few years later, I said, did you go back to Saab? And he said, no. And I thought, oh, he's not working. And then he said, I'm a registered nurse. He said, I was in the hospital so often, I decided I wanted to help others. So he's the head nurse of the ENT unit now in an academic hospital. And I said to him, what matters most to you now? And he said, I want to get married. And I did get invited to Sweden to go to his wedding. And then when I asked him the next time I met him, he said, I want to have a baby. And next, this is Wilmer, his little son. And he told me that he had no hope of a life of work, of marriage, of children, until he took over control of his own health. So I started to tell that story around the world. And next, I met a group of patients who were so excited about co-production that they created an app. They call it My Dialysis, My Choice. And now when a doctor tells a patient, well, we're going to need to put you on dialysis, a patient will say, go to the app. And they ask questions like, would you rather be in the hospital or at home or in a self-dialysis center? Do you have a dog? Are you afraid of needles? Would you rather dialyze at night or in the day? Are you working? Do you have somebody at home? And so they fill out the app, and the next, it helps them to make the right choice for what kind of dialysis they want. When they pick the right choice, the impact of the dialysis is better clinically and for the organization. But it's that idea of telling a story to empower people to take more control. Next. So I told people around the world about this. This is from a patient self-dialysis center in Philadelphia. Next. Same results. The population is almost all Black. They have a lot of chronic health problems, but they're in there doing their own dialysis and they're working, and the same metrics are now applying to this population. Next. And then a physician in Texas was caring for a Hispanic population. He translated everything I said into Spanish. Again, he's seeing the same results. And this doctor actually quit his job and got a number of other nephrologists to go to Washington, and they've changed national legislation on the payment for dialysis. So one patient, one story can have an impact on many patients around the world and even on national legislation for how we pay for dialysis. Next. And then here in Boston, a nurse midwife was taking care of a population of young pregnant women, many of them poor. And she was finding that she was rushing and doing the same thing every day. So she said one day, why don't I ask if the patients want to get their prenatal visits together? And so she gets a group of 15 to 20 young pregnant women who want to have their visits together. And they come in, it's not like any typical prenatal visit. They come into a group of 10 to 12, they have healthy food, and they support each other socially as they're getting cared for medically. It's called centering pregnancy. And the outcomes next are really quite amazing. First, I went and sat in with a young woman from Nigeria whose husband was still in Nigeria. And she was telling me how afraid she was of pain. And yet all the other women supported her. It's not just medical care, it's social care. And next, the outcomes are incredible, reducing risk of preterm births, reducing racial disparities for preterm births, and increasing the number of patients who are breastfeeding. So what we're finding is that when you bring patients together and hear their voice, now the centering model is spreading around the world, and we're finding that empowering patients is producing better outcomes at a lower cost. It's what Pedja had said about the heart and the clinical side, your brain and the wallet, put it all together and you have influence. And then lastly, next one, a few years ago, next slide, I was flying to Paris to give a plenary. And I read an article in the New England Journal of Medicine by a nurse practitioner and a physician. And in the article, it said, we can't only ask what's the matter, we have to ask what matters to you. So on the plane, I ripped up my plenary and I rewrote it with this theme. When I got to Paris, there were 4,000 people in the audience from all over the world. And I said, when you go back, ask your next patient, not only what's the matter, but what matters to you. And this nurse, Jen Rogers, was a pediatric nurse in Glasgow. Next. And she went back and asked the first patient, what matters to you? It was a little girl named Kendra who is autistic and has never spoken. So they made a poster and they put it on her door. And that night, Kendra's father, who's her only caregiver, had a cardiac event and was taken to another hospital in Scotland. Because this poster was on their door, the doctors and nurses knew how to take care of her. So Jen became really focused next on using this method, and it spread from her hospital in Scotland to Norway. Next is Brazil to Scotland. Go ahead. To Italy, to British Columbia and Denmark. And now next, we're in over 50 countries, 2,000 teams, where people ask every day, what matters most to you? And the stories that I've gotten from around the world are incredible. They are creating influence, not only for nurses, but for patients to say, this is what matters most. In Norway, as an example, I was talking to a nurse who was, he was smiling, and he told me that he had had a great night taking care of the most difficult patient on the unit. And I said, how did that happen? And he said, when I went in the morning, I said to him, what matters most to you today? And the man said, I want to wear my blue shirt. And he said, why do you want to wear your blue shirt? And he said, that was my wife's favorite shirt, and she died 2 years ago today, and I want to honor her. And the whole time he was bathing the patient, who usually fought and kicked, he said, tell me about your wife. And they had a wonderful conversation about what his wife and his marriage had meant to him. And at the end, when he was dressed, he said, take me out in the hall in my wheelchair. I want to tell all the other patients about my wife. That one question changed everything. And I think now we're seeing around the world that first nurse, Jen Rogers, last year was named Scotland's Woman of the Year, not in medicine, in the country, Scotland's Woman of the Year for changing the culture of healthcare. And it all started with a story about kindness. Next. And so as I wrap up, I just want to say that basic acts of kindness are actually leading to clinical improvements and lower costs. I was at a hospital right before COVID, and I asked a group of nurses, tell me a story. And they said, well, what kind of a story? We're not used to telling stories, but they're very influential. So I said, well, just tell me a story about a patient who had an impact on you. And they said, we'll tell you about Ethel. Ethel was a woman in her 90s who had lost her husband the summer before. Ethel had been very independent, but after her husband died, she became depressed and isolated. She had no other family. So first of all, every week a nurse would go to her house, and then it was every day. She became more and more disabled. And then she had everyday nursing assistants coming to bathe her. They'd put her in a wheelchair, give her meds, put her in front of a television, and she was deeply depressed. And one day, one of the nurses said to her, Ethel, what matters to you? And she said, I want a dog. And the nurse leaned over and she said, no, I'm the nurse. I'm from the hospital. And she said, I want a dog. And every week for 3 weeks, Ethel kept saying, I want a dog. And so finally, the nurse stopped at a shelter and she picked up a dog. And show the next slide. This is Ethel with her violin and her dog. And now Ethel goes to the hospital 3 days a week and she plays her instrument in the lobby. She is now taking care of other patients. And it all went from her being totally disabled to what mattered most, and her dog has given her meaning in her life. So next, I would say you need these skills in order to tell stories. You need to think about innovation, about spreading. How are you going to tell this story? About exnovation, getting rid of all the junk in our lives, in our patients. And then next, one example is some nurses in Belgium who started a global movement. They said in the old days, we would ask our little pediatric kids on the way to the operating room, what matters most? And the kids were so scared. They would take off their clothes, lie them on a stretcher, start an IV, say goodbye to your parents. And the stress levels when they got to the operating room were so bad that the kids needed care. So nurses went to all the automobile manufacturers in Belgium, Audi and Mercedes and Saab, and said, will you make us little cars? And now the kids walk into the car factory, they pick what car they want, and they drive themselves to the operating room. That simple act of kindness had such a decreased need for anesthesia, for pain medication. And the parents are not so scared anymore that this is now spreading around the world. And so finally, I would say, next slide, work not only on your IQ, what are you going to learn this week, but learn your EQ. How do you connect, even in this time of COVID, with what's going on? And then your CQ. Every day, ask someone, what are you proudest of? What matters most to you? And that CQ will give you all the power for stories. So I'll just wrap up there and end with my info slide and say, I'm so grateful to you all. I hope you all join this challenge because we have a long way to go in healthcare, but a global learning network like this can be incredible. Thank you.
Thanks so much, Maureen. That was really inspiring, and I mean, along those lines, I think a few things that I took from a lot of those great stories was the persistence to keep trying when people tell you no, and that your story and the evolution of your story matters in that persistence. And the second is that kind of collaboration with colleagues, and I think it's especially pertinent for vaccines at the moment, given that from the surveying we've seen that the percentage of health workers who have decided so far not to be vaccinated for COVID vaccine, who have access, is pretty similar to the general population. And so that ongoing conversation with colleagues is extremely important. And then the last thing is that inspiring innovation. You never know where those good ideas are going to come from and how they're going to spread. And so that your story has that power for impact and innovation. And so I really appreciate you sharing that. And so that's a great transition into bringing in Erica Burton, who is the Senior Advisor for Nursing and Health Policy for the International Council of Nurses, and the upcoming busy host of the ICN Congress. And Erica, I know that ICN has been at the forefront of really pushing for vaccine equity from the start, and prioritization of the workforce, and really calling out some of the issues the workforce is facing during the pandemic. And so just wanted to turn it to you to talk a little bit more about how nurses and midwives can use their voice on vaccines in particular.
Thanks so much, Vince. I'm just going to share my screen. I want to make sure that everybody can see it. Is that working?
Yep, can see it.
Okay, great. So it's hard to follow up from Maureen with those very empowering stories. But what I will add is two other elements that sort of support storytelling and advocacy. So the first thing is knowing the evidence base behind what you're advocating for or trying to achieve when using your voice. And then second, really believing in the power of the nursing voice. And I know that we're not always good at that second piece. So I want to talk a little bit today about those two parts. So first, on the topic of vaccination, a bit of evidence or a bit of the why. So we know that immunization is an extremely powerful tool for global health. We've seen this over the last few decades. Also for sustainable development, and then now really clearly for ending the COVID-19 pandemic. And so Vince ran through a few reasons at the start as to why we need nurses and midwives to use their voice for vaccine equity and acceptance. And it's really, at this moment in time, it's not just nice to have, but we need to have it. We will not reach public health goals if we don't capitalize on the nursing and midwifery workforce. And so you did mention a little bit about how we have made significant gains in the past, but that currently there are far too many people around the world who are not being vaccinated. And that includes almost 20 million infants each year with insufficient access to vaccination. And so in some countries, with the addition of the COVID-19 pandemic, we're seeing that progress has stalled or even reversed. And really, this complacency and this vaccine hesitancy has the risk of undermining all of our achievements that we've made in the past.
Hey, Erica, I think your slides are frozen, so I don't know if you are going on them or not.
They're just there so that you don't have to look at my
all right,
face.
my fault.
I
just wanted to make sure.
Not at all.
I know you can't see when you're presenting.
You
so,
can, yeah. No, I appreciate that. And so we've been talking at ICN about how really vaccine equity in vulnerable populations, in nurses and in healthcare workers, is really an issue of morality. It's an issue of ethics, and it's absolutely a human right. And since the start of the pandemic, we've been saying that this is non-negotiable. And so when you add this to then the problems that already exist with vaccination, we're seeing countries facing these huge challenges. This year at the 74th WHA, the World Health Assembly that was held in May, WHO Secretariat really expressed their reliance on member states or on their countries to continue to empower communities and health workers to improve the reach of efficacy of immunization services. So we're an extremely important resource. And then we look at how we have inequalities in COVID-19 vaccine access. And it's an issue for the health workforce. It's an issue for protecting our patients, their families, our communities, and then the broader health of countries. And what we're seeing right now, unfortunately, is that younger and less vulnerable people are being vaccinated in some countries before healthcare workers and vulnerable populations in other countries. And so ICN has been calling for more vaccine equity so that healthcare workers, healthcare students, and vulnerable populations, more importantly in middle and low income settings, receive the vaccine, the COVID-19 vaccine first, before some of these high income, less vulnerable, and younger populations in other countries. And this is really an issue of supply. You know, if we had endless supplies and access to vaccination, this wouldn't be an issue. So prioritization is really the key word here. And the result of this not happening is devastated. It's going to be a continuation of healthcare worker infections and deaths. As Vince mentioned, 115,000 healthcare workers have died, which was announced by Tedros at the World Health Assembly this May. And not only that, these lasting effects of these huge mental health impacts, this burnout, and then eventually, nurses and midwives leaving the profession, which we've discussed in length why we can't have that happen. The second piece is that we need to use our voice to advocate as well for what health systems and the health workforce needs to deliver these immunization programs. So even if we figure out availability, we also need to make sure that there are adequate resources to administer the vaccines and to get them to people. And so again, we're calling on strengthening and investing in our workforces, in nursing workforce and midwifery workforce, to make sure that we have the appropriate resources and that we have the sufficient support for that. And then there's also the issue of acceptance. So the Independent Panel for Pandemic Preparedness and Response found that in many countries, trust was a deficit, and that was a significant factor in effective COVID-19 response. We're also still battling an infodemic, and that is almost as harmful as the COVID-19 virus itself. So we have mistrust and misinformation and disinformation, which is not only discouraging people from engaging with these really important public health tools like vaccination, like masks, but it's also eroding this public trust in health workers and in nurses. And in our governments and our health organizations. And those are the people who are really leading the fight in COVID-19. And so you have this duality, and not only do we need folks to be vaccinated, we also need to make sure that we don't lose this public trust and this really powerful position that we have. So moving forward, it's really our job and our role to try to restore this public confidence. And that requires action from a whole slew of stakeholders and a lot of different strategies. But just in the next few minutes, I guess the most pivotal strategy is really harnessing what we already have, and that's the public's trust in nurses. Maureen mentioned it, that year after year we are voted the most trusted healthcare profession, or the most trusted profession. And why this is important is because we know that this unprecedented effort to vaccinate essentially the entire world, or a very high percentage of the world, will rely on people's extent or willingness to be vaccinated. And so what we want to do is we want to prevent this reversal of these very hard-won gains in global public health that we've achieved with vaccination. And we want to continue this route of the population engaging in vaccines. And so we've heard that people's behaviors, people's willingness to follow public health measures will be some of the most powerful weapons to stop the spread of the virus. Second slide. So this is just looking at some of the work that ICN has been doing in this area. And so the second issue the first issue was sort of understanding the reasons why and the evidence behind it to back up that storytelling, that advocacy, but then it's also being confident in your impact. And you've definitely heard before that the nursing voice is impactful and is powerful, but I'd like to just spend a few moments linking that to vaccine equity and acceptance and how to work that into advocacy. So for years and years, the International Council of Nurses has advocated that nurses play a really important role in immunization. And we know that actually in some areas of the world, they are relied on solely to carry out immunization programs. And that includes supervising other healthcare workers to administer and to train. And so just in the last 5 months, as you can see on the slide there, we have been advocating on behalf of nurses for a number of issues. We've been reporting on the role of nurses in mass COVID immunization. We, along with the members of the World Health Professions Alliance, have called for acceleration of vaccine equity for all frontline health workers. We've backed the WHO's Vaccine Equity Declaration. And then, of course, we addressed the 74th World Health Assembly, and we've highlighted again this critical role of nurses. And not only in delivering vaccines into people's arms, but also in all of the levels. So planning, management, implementation, monitoring of these immunization programs, and then prioritization of healthcare workers. And so the voices of nurses are really, really needed now more than ever. The pandemic has shown us that, like I mentioned a few minutes ago, we really need this trusted communication, and we need this to be people-centered, and we need it to be community-led. So this has to come from within, and it has to be spoken in the language of the people who are receiving this. And there's no better person to do that than a nurse. We have such an ability to disseminate across a huge range of settings clear, concise, accurate, and trusted information. And this also includes to our fellow colleagues, to our fellow nurses and midwives themselves, which, as we know, is that we're going to need to close. And not to mention, we're the largest provider, clinical provider, and the largest clinical provider of immunization. And so this kind of intelligence that nursing offers is so critical and is so priceless that really I would argue that there's no other profession that can offer this mix of both situational knowledge of the needs of people and this trust and this training and understanding of these healthcare decisions to influence this. We have done a survey on the role of nurses in COVID-19 mass immunization, and we've confirmed some of this information that we've known from the past and that we've been hearing in the media recently. And the survey showed that based on a set of indicators that the 3 countries where nurses were involved the most in COVID-19 of all the countries surveyed, where they were involved the most in COVID-19 vaccination and planning and implementation, especially with training and with providing information. They had a lower estimated rate of their adult population who were actively against COVID-19 vaccine, and an increased proportion of their population of adults who were vaccinated. And even following the resolution of the supply of vaccines, so they looked at countries who had, full access to supply and there were no access issues there. The findings suggested that nurses were actively providing information and support to develop educational resources and tools concerning the importance of vaccination. And then in countries where there were the least amount of information, estimated vaccine rates and resistance were much, much higher or were unknown. And so we do need a little bit more research to explore the extent to which nurses' involvement really reduces hesitancy specifically. But we know that where nurses are really involved in the entire process of immunization, we have an increased rate. I will just show you here, and you can read it as I read it. And this is, as we all know, Israel was a leading country. They had a fantastic supply of COVID-19 vaccine on their side. So that's, that should not go unmentioned. But a leading nursing policymaker in Israel said this following quote: I think that here in Israel, the nurses were the leaders in decision making, how it could be done. A vaccination campaign is a campaign for nurses at all levels. Nurses have been real leaders in this event since it started, with the involvement of the nursing administration in determining the strategy and participation in the decision making. At every administrative board meeting, which included all the representatives, all the senior executives in the system, including the health minister and the prime minister, the profile of the performance, arrival, and follow-up of the vaccinations was presented by nurses. Wow. And this is just such an impactful story. And you can imagine this taking place in a boardroom where the prime minister was sitting and a nurse being the one to present this. And so in many of the countries in our study that were highly effective in immunization, nurses are involved. They're involved in national strategies and committees. And so the last two things that I'll say is connect with your nursing, National Nursing Association. NNAs offer really important contributions to these national strategies, and they have such good contacts, so they can facilitate this, this planning and this strategizing. So really engage with your NNA. And then finally, I really think that we need to increase the number of expert nurses' voice in the media. So this challenge that is presented to you today, 7 lucky nurse winners, is so valuable because it allows you to have this practice and practicing your advocacy skills and trying to get your voice heard and out there. So I'll finish there, but I appreciate this, and this is such an important session. My final slide there is, as Vince and others mentioned, our Congress is I think we have 1,500 sessions, and you have access to this for 6 months. So please register to learn more. Thanks so much.
Thank you, Erica. Really appreciate it. And apologies, we're running late, and so we may run a bit late, but we're trying to fit as much in. We know folks will have to move on probably to other things. So, but really appreciate that, Erica. And I want to turn it on those particular opportunities for advocacy to Nahashan Aluka. He's the advocacy lead for the Pandemic Action Network in East and Southern Africa. And the Pandemic Action Network, Sabin is a member organization. It's really been driving a lot of the global advocacy on COVID-19 vaccine to policymakers globally. And so Nahashan's going to outline a few of those, a few of the pushes that the global community is trying to make to world leaders on vaccines. So Nahashan, over to you.
Thanks a lot, Vince, for that introduction. I know you're running short of time, and Erica has just covered quite a bit of ground, so I'll be as short as possible. Let me just get to share my slides quickly. Share screen. Okay. Has it come up? Can you see it, Vince?
I haven't seen it, but we'll give it a second. If not, Nasha. Oh, it's coming now. Yep.
It's coming. Okay.
Yep. We can see it. You may want to start the slideshow now.
Yeah. I think in the interest of time as comes, I'll focus on just 2 slides if it comes, but let me just speak through it in the interest of time. So when we were asked to reflect about advocacy opportunities, we felt, what are the advocacy opportunities that we have? And I think Erica and other speakers have touched on this. From a Pandemic Action Network perspective, we have identified 3 key main advocacy issues. One of them is on access to COVID-19 tools, including vaccines. The other is on vaccine hesitancy or vaccine education, and the other advocacy area is, the challenge of transforming vaccines into vaccination. So those are 3 broad advocacy areas. And what opportunities do we have, and that we would want to propose for nurses and midwives in this call? Before I delve into that, let me just mention that with the COVID pandemic, we have observed 2 major changes in the way advocacy has shifted. We've seen a lot of shift from direct community engagement and engagement of policymakers more to online engagement. And we have also seen less community consultation and engagement because of the COVID challenges. That means there's a weakness in community level participation in decision making. Now, what opportunities does that present for us, in this call as nurses and midwives? One, we have less of community voices because by online engagement, there are a number of people who are not having access to the online technology that we are using. The communication infrastructure does not support the engagement. So there's quite a bit of voices that are left out. And nurses, midwives, given the geographical distribution where you work, you are at the forefront. And you can play a great role by sharing your stories that reflect the community voices in advocacy work. Again, we also know that amongst health workers, there are those who are still hesitant. They have not taken vaccine. They have not made the decision to take vaccines for various reasons, safety, effectiveness, name it. It's another opportunity to play a lead role at the community level to also influence your peers. And, just as shared earlier, the story of Harriet, for instance, those stories bring the human, bring a human feel to the global problems that you're addressing. And the more you share the stories, the more it makes it easy to tie the global advocacy challenges to actual local impact at the community level. So it becomes very easy to address or to bring the human face to that. And lastly, and this is a significant one. We have advocacy networks, partnerships wherever we are. And with the COVID pandemic, it has become difficult to generate evidence for advocacy because of some of the challenges that have been mentioned. And so by sharing your stories, by documenting what's happening at the level where you are and sharing that, it also helps to inform and reinforce the advocacy messaging that would also be important in terms of helping us address hesitancy and misinformation, and can also help in development of different advocacy tools, be they policy briefs, name them. To close, let me just, leave you with a line. They say, statistics tell, stories sell. Let us speak up and share our stories. I wish I had more time, but I'll have to leave it at that. Over to you, Vince. Thanks.
Thank you, Nashan, and I apologize, there was some slide issues there, but but we will share Nashan's slides, and they're there's going to be many different opportunities. Erica had mentioned the Vaccine Equity Pledge. Pandemic Action Network had a roadmap to vaccinate the world that they had put out. Coming up, there will be the UN meeting with all the world leaders. There'll be there'll be treaty negotiations over a potential pandemic treaty that the WHO is leading in December. And so as we go along, I think it's very important that what Nahashan was mentioning to connect the storytelling and the work in the community to that work in your country, to call for the policies, to call for the investments needed that both prioritize the workforce, prioritize the information that you need, prioritize the information campaigns out there. And so nurses' voices are going to be critical to the success of those advocacy campaigns to get both the investments and the policies that are needed. And so that wraps it on the speakers and and so right now I'm going to turn it to Menashe Nika. And before I do, I would just say that I apologize, we're running a little bit late, but we hope you do stay with us because Menashe, who is a registered nurse himself and one of the Nursing Now Challenges board members, is going to lead a discussion of several different nurse and midwifery leaders from around the world that have agreed to share a little bit of their stories today to help inspire and think about how we can take this forward. So Menashe, I'm going to turn it to you. Folks, please do continue to engage in the chat and share your stories as some of our colleagues are sharing theirs, and also continue to answer your questions. And we'll have a second webinar as well on August 24th that will continue this discussion. So Menashe, I'm going to hand it over to you.
Sure. Thank you so much, Vince. And it really is inspiring just listening to our speakers and really hearing about the importance of storytelling. And I think it gives a great segue into our next session as we move into a panel discussion with amazing and inspiring nurses. And the title of this session is ably titled Voices for Vaccines. How can nurses influence vaccination access and acceptance? So we've got a panelist of amazing nurses from across the world that are going to be able to share with us on their experiences. You've heard about Harriet, who has been shared throughout this webinar. She's also part of our panel as well. She'll be able to share her story. And just to hear a lot more about how nurses can be able to influence access and equity and acceptance in terms of vaccines. So without further ado, we'll start with our first speaker, who is George Chale, coming from Mexico.
George. Hi, thank you. Nice to meet them. I'm George Chale. I'm 24 years old. I'm from Mexico, and it's a pleasure to be with you today. Thank you very much for the invitation. So during my career as a nurse, I have spoken about the issues that I believe in, and the issue of vaccine is no exception. Nurses have been the protagonists of vaccination campaigns in Mexico and the world, and we have always been the first line. We are experts on the subject, and we are the first contact with families. But while we are the first contact, we are the ones who have identified the main access and acceptance problems. In my experience as a community nurse, the main challenge we face are: one, we need nurses in the most vulnerable and remote places. We need vaccines in the poorest countries and the solidarity of those who have the most. We need nurses in leadership positions to guarantee access and equity in health. We need to empower nurses. We need to strengthen public health. In many cases, primary healthcare, prevention and health promotion is not a priority, and the biggest investment is in secondary and tertiary care. But we have other more serious problems in the field. Security. Families do not open the doors of their homes for fear of insecurity. The economy, the families have more than 3 children and their home is far from the health center, so they prefer not to go. Poverty, we have a health system where those who have the least think that they have no rights. The media, we know that they can be a powerful tool to convince, but also a powerful weapon to misinform. The COVID-19 pandemic, families closed their doors for fear to infection and shortage. Families stop believing in us due to lack of vaccines. And although nursing is the most trusted profession in the world, in many cases, trust is lost due to a poor health system. And I would finally like to say that the best hope on earth today is vaccination. And we have the means to stop the COVID-19 pandemic and eradicate the diseases. But I think it takes political will to achieve it. Nurses in political office, nurses in the country's Congress, nurse leaders of the ministries of health. And for this, we must work together to achieve sustainable development everywhere and where no one is left behind. So thank you very much for the invitation. And this is my presentation about my opinion about this topic. So thank you very much.
Sure. Thank you so much, George, for that. And I would totally agree with you that nurses, we're the ones at the forefront and we're able to really advocate on these issues because we're the ones communicating directly with the community. And in terms of being able to advocate for equity and access and acceptance, we really have a lot of impact that we can be able to give. So thank you so much for sharing that. Our next speaker is Harriet Naiga, coming from Uganda. Harriet.
Thank you very much, Monashe, and thank you very much, Nursing Now, and everyone who is attending this very, very important webinar. My name is Naiga Harriet. I'm a midwife from Uganda. I'm the director of Midwife-Led Community Transformation, MILCOT, a community-based organization that is aiming at bridging the gap which exists between the midwife and the local community through provision of sexual reproductive health and survival skills to marginalize the adolescents and young adults. I'm a Nursing Now Challenge champion and one of the members of the Challengers Committee. I'm also a member of Partnership for Maternal, Newborn and Child Health. I'm a strong advocate that I know, and I believe that there is power in the voice. There is power in the word that each one of us can speak out. And you never know how powerful your word will be, not until you say it out. In this century, the world has proved that nurses and midwives are the leaders in healthcare. And we have to prove this to the world. And there is no other best time than this. This is the best time for us to raise, because in this global challenge, everything will come back to us. We are into it. If we do not speak out, it will still be us to solve the challenges that will come later. Every one of us knows how nurses and midwives have suffered during the pandemic. Some of us have lost their lives, and the many people who have died. It is us who care for the population. And in the times like this, every one of us belongs to a community. And I can think about the many waves that come, wave after wave, wave after wave, wave after wave. If we are in a recess and we are not sure whether there is a wave coming, but we know when it comes, it will be us, the nurses and midwives, to struggle, to juggle. Then that means we have to prevent it now. How? We are leaders and we have to lead from the front. We have to be examples. Good leaders are leading by being examples. That means we have to advocate, we have to raise the voices to fellow nurses and midwives and all health workers to go for vaccination. Because it's really sad that we know the impact of COVID-19, but even amongst us, the nurses and midwives and health workers, many of us have not yet gone for vaccination. When vaccines came and I rushed to get mine, I knew that was going to cause a lot of impact in my community, first amongst my team, the people I lead, and then in the community, in my country and globally. And when I went for vaccination, I couldn't keep quiet. I had to say it out. And through Nursing Now, when I was invited as a guest speaker on WHO press conference, I had to share my story. I shared the story before getting the vaccine because we were all anxious. We were in fear because the general population had fear. We were waiting for the vaccines, but we had to advocate that let us be the first people to get the vaccine. And my voice was heard at WHO platform. And today, when I got the vaccine and I didn't get any problem, my community had to know. The young mothers and all marginalized adolescents and young adults I work with, it takes a lot of time for them to accept that I have to take the vaccine because there are a lot of myths and misconceptions that the vaccines will kill us. But who is supposed to allay their anxiety? They have a lot of trust in us, the nurses and midwives, because when we are leading care, they know that we cannot tell them something that is harmful. And so when I tell them and I show them my card that you see, I went for vaccination. I didn't get any problem, okay? Once they hear that, they start to bargain. Can I go or not? And I start to tell them that if you want to go, I can help you and drop you there. So that is how I'm being so practical at community level and also at country level. I use social media. We have seen the presentations that social media is so powerful. And during this century, we have found it to be almost the most important. And it's free to every one of us. Let's utilize it. I didn't know how powerful my email was, not until Dr. Tedros brought it up and used it as an opening remark. And then I have received from around the world thanking me. They have been sharing that message and it has affected huge. Imagine, but I want to say that each one of us has a voice, and the voice of a nurse and a midwife is so powerful. It's very, very trusted. So let us time to speak out, to bring a change in healthcare so that we can see a difference in sustainable development goals towards achieving them. So that's what I had to share, but I want to say thank you so much, Nursing Now, because if not Nursing Now, it would still be hard for us to say that, we can be heard. Remember 2 years back, we used it to say, we are not heard. No one is hearing us. These are the platforms. So thank you so much. That's what I had to say.
Sure. Thank you so much, Harriet. Sorry to cut you off a little there because of time. But really just to share how I think your story really highlights how being able to use your voice and your experience has been able to reach such a high platform as the WHO. So it really shows the impact that we have in being able to share these stories. I'll move on to our next speaker, who is Amy Staley from the USA.
Good morning, everyone. Thank you so much, Harriet, for sharing your experiences. They're so inspiring. Here in the US, vaccine acceptance and also the discussion of potentially mandating the COVID vaccine is a big discussion right now. I would urge others that as we rush to return back to normal, let us consider which parts of normal are worth returning to. While a mandated vaccine might not be something that we're used to, it's definitely necessary to allow us to return to doing the things that we love. As Maureen mentioned earlier, nursing has been the most trusted profession for the past 19 years. And I urge individuals in the US who have access to the vaccine to trust the data, trust the science, trust your nurses, and get vaccinated. Throughout the pandemic, we were working, everybody was working from home. And many continue to ask, what can we do to help you and support you on the front lines? So this is us nurses using our voice and letting you know that this is what you can do. You can get vaccinated, speak out in your communities. You don't need to be an elected official or a politician to make a difference. And I think that's something that Voices for Vaccines is showing us, is that anybody here can make a difference. So why not it be you? As for nurses and healthcare leaders, we need to step up, provide accurate information and teaching to those impacted by misinformation. This is part of our role in healing our nation. And as we continue to live through these unprecedented and uncertain times, we need to realize that this vaccine is a little bit of certainty. It's the opportunity to slow the spread of this virus that has already taken way too much from us, and that is absolutely worth a shot. So thank you, Nursing Now, and everybody for giving me the opportunity to share.
Thank you so much, Amy. And I like your statement that you've just shared, that anyone can do it, and why not you? We'll move on to our next speaker, who is Rita Akiki, coming from Lebanon.
Good afternoon. I'm Rita Akiki. I am a registered nurse from Lebanon. I also work as a nursing director at Abu Jawdi Hospital. What I'm going to share with you is our experience as Lebanese nurse and our advocacy to help the patient and the community to get vaccinated. Next. So in Lebanon, the vaccine is free of charge, and there is an official platform to register. And there is also a hotline to help people to get registered. Besides all these efforts, next, there is a minority of people that are vaccinated. Only 40% of the population get their vaccine. What we did at our facility next is that we are engaged to help the people to get off the problems, to get more trusted in the vaccine, to not ignore the importance of the vaccine. Next, so what the nurses did to do this change, and we were a very important agent of change, was raising awareness. We convinced 250 personnel and employees in our facility to get all vaccinated. And also we work with the hemodialysis patients who are vulnerable population to get vaccinated. Next. So in our story, what we did, in fact, was launching more than 4 webinars. We used the Facebook platform, which is accessible in Lebanon to all the population, to speak about the importance of the vaccination. We also collaborated with the infectious disease physicians, and we were being role model. Every nurse get her vaccine was getting a picture and was putting her picture in the Facebook, so all the population and all her friends can see and can be a role model for them. Next. And also what we did with the hemodialysis department was listening to the concern of the patient. We used to work one-to-one with the patients to convince them to get vaccinated. We get to the evidence-based, to the scientific information, what is the importance of the vaccination that is not harmful for them, and they can get their vaccine even if they are vulnerable, even if it is a new vaccine. And then we selected a champion patient, and that was really wonderful. One of the patients was the champion in every shift at the dialysis department. He was telling his story to the other patient and he was convincing them. So next, What I like to share is that the nurses' advocacy, this empowerment to nurses helps them to help their patients, especially the hemodialysis patient, and they get the contagious to all their families. So the family of the patient also get the vaccine, and this role modeling and sharing their experience with their patients was very important to the patient, since that the patients get their vaccine. And also, we are emphasizing on an important thing, that is a moral duty to get vaccinated for the collectivity where we live. Well, when the nurses are vaccinated and they speak up to the other population, it is very important to convince the people and also to convince the vulnerable population. Next, and thank you for getting me to share our experience in Lebanon.
Thank you so much, Rita. Really great to be able to hear about your experiences from Lebanon and really seeing nurses as agents of change. We'll move on to our next speaker, who is Rashid, coming from Malawi. Rashid, can you hear us?
Can you hear me? Hello, everyone.
Yes, sorry, I think you were on mute.
Yeah. Sorry, my network is unstable, so please bear with me. I'm Rashid Manganda from Malawi. I work as a registered nurse in Palombe District Hospital. I also coordinate maternal and child health program in the district. In addition to that, I work as COVID-19 surveillance and response nurse in the district. Mine is a different story from the rest of the speakers. I would like to advocate for my country. I'm going to talk about the challenges that Malawi is facing in rolling out COVID-19 vaccine. About 0.8% has been fully vaccinated, and about 1.6% only received the first dose of AstraZeneca vaccine. This low uptake to COVID-19 vaccine has been attributed by a number of factors. The most challenging factor is the community resistance in getting COVID-19 vaccine. A lot of people in the communities have myths and misconceptions toward this COVID-19 vaccine. As such, they opt not to get COVID-19 vaccine. They believe that COVID-19 vaccine is a deliberate drug that was introduced just to make them infertile or make them sick. So they thought the COVID-19 vaccine is not safe for them. The other factor is erratic supply of COVID-19 vaccine in Malawi. So far, we have received only 704,000 doses against 19 million plus population, which is very inadequate. Now that people have been sensitized and they are able to take the vaccine, but they cannot access the vaccine because in the facilities there's no vaccine. The other challenge is healthcare workers refusing to get vaccine. As one of the speakers said, it's a challenge here in Malawi as well that there are some few health workers, they are not interested in getting COVID-19 vaccine because of religious beliefs or some other beliefs. This is demotivating other people in the community to say, if healthcare workers are not interested in getting vaccine, why should we get vaccine? So this is demotivating, is disturbing the COVID-19 vaccine rolling out. So in order to improve COVID-19 vaccine uptake, local leaders in the communities should be empowered and should be in forefront in advocating or sensitizing people in the communities and be exemplary. For example, our president here in Malawi was the first one to get vaccinated. I think that should be the case as well in the communities. The other method is, I suggest that since COVID-19 vaccine is not mandatory, I suggest COVID-19 vaccine should be set as a prerequisite in accessing some public services or some crowd pulling events such as festivals, shows, or meetings. To say if one wants to crash into a festival, should should produce an evidence that he or she was vaccinated. That way, a lot of people will be motivated and get vaccinated. And also, people can be sensitized. Local leaders can be empowered, but if you don't have COVID-19 vaccine, people cannot get vaccinated. So it's my plea that Malawi should also receive adequate doses of COVID-19 vaccine. As I said, only, for example, here in Palombe, the district where I work, only we received only 400 doses against 400,000 population, which is very inadequate. So I plea that COVID-19 vaccine should be equitably distributed in all countries, especially low-income countries like Malawi. Thank you so much.
Sure. Thank you so much, Rashid. And I think you really highlight the opportunity that we have as nurses to really advocate and really push advocacy in terms of acceptance of the vaccine in communities. So that's been really great. Really just to thank all our speakers. I know we've had to rush through the panel session. It would have been really great to get a lot more conversation going on, but really just to thank you all in being able to be with us, and to everyone who's stayed on with us up to now for the rest of this panel session. Thank you so much for being with us, and thank you so much for sharing your experiences. I'll hand over back to Vince so that we can close off the session.
All right, great. Well, thanks, Menashe, and thanks for such great stories. And I echo what Menashe just said. We really, this discussion at the end was excellent, and I apologize that we ran short on time. And so we were already just talking about the next webinar that we're having on August 24th, really digging into some of the issues that were raised during this a little bit more. And so obviously we have the challenge. We encourage and we want you all to think about what would be helpful in your country with the nurses in your national association. Erica mentioned getting involved in your national association, and nurses and midwives. There's also national associations for ICM, the Midwifery Association, getting involved there, thinking about what type of advocacy activity could you help lead? I think Harriet's story is really inspiring in terms of, what a simple email, what a simple story share can really mean and impact. And so, think about it, put your proposals together, but the challenge in itself is by no means the only piece here. There are so many areas that we were just, that were mentioned today. I think that the issue that Rashid just mentioned of some of your own colleagues, taking the opportunity when presented to get vaccinated for COVID-19. What questions do they have? I mean, there's many different issues related to vaccine acceptance here. And so, it would be great to talk a little bit more the next time on what are some of the ways that you've seen successful, either in your own work or conversation with colleagues, to help convince colleagues, to help inspire others to advocate. So we'll continue this conversation. We'll have another webinar on the 24th. We look forward to seeing your proposals and continuing to carry this forward in the months ahead. So thank you all for joining us. Please do send any questions to the email as well as your proposals, and we look forward to seeing you all on the next webinar. Thank you so much. Bye-bye.